Hi everyone, welcome to my channel again. My name is Nos Ifi. Today I am going to be talking about rheumatoid arthritis, commonly known as RA. This rheumatoid arthritis is a chronic inflammatory disease and can affect any organ of the body. So the rheumatoid arthritis is inflammative degenerative joint disease. The RA can affect any part of the organs or the joints. So, first of all, I would like to go through some of the points about this disease. Um, it's common with people of certain age brackets. So this is common with people usually between 20 and 50 years of age. And it's common with women more than men. This disease often develops suddenly within a week or a month. It, the symptoms for this disease is usually a generalized pain, which is usually common in the night or at rest. When you are trying to rest, this pain comes in, or usually in the night, more common in the night. There is always stiffness in the morning, which lasts for an hour or so. This stiffness, sorry, I'm outside and the mosquito or this ant is kind of disturbing me. So sorry, that's why I'm moving a lot. This joint stiffness is common in the morning hours of the day, which lasts for at least an hour in the morning. There is what is called joint motion, a decreased joint motion. Other things you see about this, other symptoms that you begin to experience in this disease is things like depression, fatigue, low grade fever, insomnia, uh, weight loss, and weakness. So there is those are the some of the symptoms you experience. You also can experience things like physical signs like multiple joints involved, usually symmetrical. So symmetrical means it can be happening in this joint and be happening in this other joint. And joint typically involves the hand joint, the feet, that's the small joint in the feet, then the wrist, the elbow, the knee, the ankle, the shoulder, and the arm deformation. The hands of the person usually like begin to bend um, those hands. And there is a lab value that can be used to detect this disease. They have the RF elevation of AD of a client with rheumatoid arthritis. They usually do some lab like the ESR, and then they decrease red blood cell and the C4 uh, complements. So when this disease happen or when this begin to happen in that person, what usually take place is that when you come to the joint, the synovial fluid and the cartilage begin to uh, lose. You begin to lose things like the cartilage and the synovial fluid. It's inflamed. Okay, so this disease is very important to me because I remember my grandma having rheumatoid arthritis. So when I read it and saw, like the deformation of the finger, because I growing up, I saw my grandma with her hands begin to deform to that form. But little did I know this is rheumatoid arthritis. So when I finally read about this topic, I I was kind of, was that what was happening to grandma in those days when we were growing up? So, um, so that is what happened. So, and this person usually have a lot of pain, because what happened is that as he begin to lose this synovial fluid and the cartilage, this cartilage is used to join the bones together. So say in the bones on my in my finger here, if I begin to lose the cartilage on it, this fly won't leave me alone. If I begin to lose the cartilage here, because the bone here and the bone here, they are all joined together by this cartilage and the flow and the synovial fluid that is there. So as you begin to lose this cartilage and the fluid become infected, inflamed or infected, so there is always a lot of pain. This person, the only thing that they complain about is pain, and this pain can keep them awake all night. This pain can make them not get enough rest. Sometimes it makes them a little depressed and fatigued because they are not able to sleep. When others are sleeping, they are in pain. So the things that you also begin to experience is swelling in the joints, which is associated with the pain. You can see there is a warm, swollen, pain, decreased motion, and possible the rheumatoid arthritis, the rheumatoid nodes. So the joints are kind of swollen. So these are some of the stuff that this person can experience. So I just want to show you a picture that I found about this somebody who had this disease. So what is going on in their joints? This is kind of what is going on in their joints. I don't know if you can see it very well. So on this side, it's normal. This is the normal joint we have, but this one here, you begin to see that how the person is losing the cartilage and the inflected synovial fluid. So that is just a little picture that I found to show of the joint in, and how that really occurred in the body. So, to help this patient, we have to treat pain. Pain, pain management is one of the things that we have to treat in this patient. So we really have to watch their pain. We first of all have to start with NSAID, which is non-steroid anti-inflammatory relief medications. So these are things like Aleve, um, Advair, naproxen, ibuprofen, or Motrin. Some people call it Tylenol, and so things like that. Those are over-the-counter medication that we can use for this patient. But if that is not working out, and remember that there is a side effect on taking anti-inflammatory medication. When you are taking anti-inflammatory medication, especially things like a Tylenol, acetaminophen, so there is risk for GI bleed. So I will not try to suggest to the patient not to take it. I think it's like 500 mg that is not supposed to take more than that in a day. But please consult your doctor also on this particular dose, because I am not actually sure right now. So um, secondly, it's the steroid. So the steroid is another medication. The steroid are drugs like prednisone, solimedrol are used to reduce pain and inflammation. and the slow joint destruction. So what steroid do, or what steroid does, is that it helps reduce the pain and the slow down the inflammation. We slow down the destruction of this cartilage in the joint. Okay, so another medication that we can also use for this disease is a disease modifying anti inflammatory drug, which is commonly known as DMRAD. That is the common abbreviation. It helps to reduce the amount of joint pain and slow down the damage to all tissue. The most common DMARD, that is the disease modifying anti-inflammatory drug disease, include the it include the hydroxychloroquine, and it also include the minocycline. So this, I think these are not over the counter medication. This medication you have to be prescribed. This medication has to be prescribed by a doctor. It's not something that you can find over the counter medication. The steroid also, it's not something that you can find over the counter, um, because the doctor have to put you on the steroid, and the steroid is supposed to be taped down. You just don't stop it like that. If you it's taped down before you stop steroid. The doctor has to tape it down. He has to put it to some point. Like if you're taking two tablets a day, he might put it for you to take one tablet a day, and then they cut it into half. Sometimes he does it to one and a half. They reduce it to one and a half, and then go to one. Then from one, they reduce to half. And when you are taking steroid, one side effect I really want to mention in this video is that steroid increases the blood sugar level. So when you are taking steroid, prednisone, solimedrol, the patient really have to be careful about their blood sugar, because their blood sugar could be elevated with this medication. So it's another thing that we educate our patients who are going home with this medication to know that their blood sugar might be going up even if they are not diabetic. So their blood sugar might be going up. The other one is the immunosuppressant calms the immune system, which is typically out of control for the client with RA. So the client with RA, their immune system is out of control. So they usually give them this immunosuppressant. So these immunosuppressant drugs are things like cyclosporine, cyclosporine. They help calm this their immune system that is going out of control, because like I said earlier at the beginning of this lecture, I said the immuno rheumatoid arthritis, it's an autoimmune disease. So this immune system is going crazy. So you need this medication, and then like this medication also is something that need to be prescribed by the doctor for the patient to use. So and the other one I need to talk about here is the um, tumor necro- necrosis factor alpha inhibitor. So this also helps to treat the inflammation in the patient that have uh, rheumatoid arthritis. So there are some non-drug alternatives that we can use also, that can help relieve this pain. And usually, I always advise that patients start with the non-pharmacological therapy first before you go into pharmacological therapy. Why? Because every medication has its own side effect. Something like steroid we just mentioned about. I told you that this thing is going to increase your blood sugar. And another thing I didn't tell you is that people on steroid kind of make them gain so much weight, that it's very not very good. You know what weight is. Weight can cause you to be having difficulty breathing. It can, the movement, fatigue, and all that stuff, not doing things as usual. So, the non pharmacological therapy, an alternative treatment is the injection of the Vesco supplement. This Vesco supplement acts as a lubricant and substituting for this hyaluronic acid substance in the joint. The pain relief appeared for at least disappears it disappears for at least 6 to 13 months. Wow, I think this is good. So this is just like an injection they inject in that area that helps to um, relieve the pain for at least 6 to 13 months. The side effect, it's reduced. Things like swollen, redness, or heat at the site of injection. Those are the things that you see. So side effects include swollen, redness, heat at the site of injection. So when this injection is given at that site, we will find it that it will be swollen, it will be red, and you'll feel some heat. But um, I think I think that would be a better price to pay than to be in pain and not being able to sleep all night. So the client, you should, if this client is allergic to egg, he should not receive this injection. So if client is allergic to egg, this injection is not for them. So check patient allergy first. When you're giving any medication, make sure that patient allergy is something that it's stressed out, is checked. So another this thing here is the surgery. So surgery is another option for this patient. So there are several surgical techniques that may be performed to minimize or correct the joint deformation of an artery. Um, so it says many individuals with various types of arthritis undergo arterioplasty or reconstruction of the joint using an artificial joint that uh, that restores previous lost function and relieve pain. Okay. Then the second one, in addition, the client with this can also go for salivio- salivionectomy, which is a procedure for the removal of the lining of the joint. So this procedure is performed when the lining is inflamed and adding to the pain and the client that the client is experiencing. So there are two types of surgery that the patient can go, which one is the arterioplasty and the syneviectomy. So the other one, the arterioplasty is to replace the um, reconstruct the joint, while the syneviectomy is used to remove the lining of the joint that has been destroyed. So nursing management involve teaching the client about the disease and providing information and general health relief, pain relief, and reducing stress, decrease inflammation process, and providing joint mobility. The nurse also should instruct clients about the medication regimen and the particular therapeutic adverse effects. Okay, just like I have said earlier, that I said the drugs, the side effects of this medication, like NSAID, we have to deal with bleeding, GI bleeding, we have to also deal with the steroid. We have to deal with weight gain, and the elevated blood sugar. So, and then the one with injection has a side effect for somebody who is allergic to egg. So if somebody is allergic to egg, that option is not for them, you know. So the next one is, make sure that the patient the activity is planned towards later in the day. Because what did I say at the beginning of this lecture? I said that this patient usually feel pain in the morning. So if there are activity, if there is something that is scheduling, if there's a procedure that's could be to be done or something to be done, it can be scheduled later in the day when the patient usually feel better. Because if it's scheduled about in the morning time, um, this patient is usually having whole lot of pain. So, and I don't think he's going to be cooperating with that activity. The nurse, the nurse should continue to urge the patient to eat nutritious and balanced diet, despite the some the loss of appetite that some of them might be experiencing, or because of the chronic pain, you know. Secondly, we have to also make sure that every hygiene activity is done later in the day to avoid this pain of the patient. All right. I hope this helps somebody today. If you have a question or something that you do not understand, or you want me to, some other topic that you want me to talk about, um, please hit comment down below. I will be glad to, discuss it. Yes. Make sure you subscribe. My name is Nurse Ify, and thank you for listening, and see you later. Bye.